Good day, everyone. I am Athena and Montecalvo from BSHM1 Charlie. So now, I'll be presenting the different accidents or injuries that usually happen in a workplace, and I will be showing also on how to perform the basic first aid in every injury and how can we prevent these kinds of accidents. So, keep watching. Thanks. So, let us start with slips, trips, and falls. This is the leading cause of general workplace accidents and injuries, ranging from minor bruises to several traumas such as head injuries, broken bones, sprains, and laceration. In fact, slips, trips, and falls are often reported as the most common causes of workers' compensation claims. Slips is defined as the loss of balance when there is too little friction between the foot and the floor, especially when stepping on a wet or oily surface. Next is trips. This is the loss of balance when the foot collides, strikes, or hits an object in its path. And lastly, falls. It is a downward movement, typically rapidly and freely from a higher to a lower level. So how can we prevent slips, trips, and falls, by the way? So the first thing we need to do is to clean up the spills or the wet area immediately. So next is we need to keep walkways and hallways free from debris, clutter, and obstacles. So next is keep filing cabinets and desk drawers shut when not in use. And lastly, use a ladder if you're trying to reach something. So how to perform first aid to a person who falls? So the first thing we need to do is to approach them calmly and reassuringly be alert to any dangers to either you or the casualty. Do not rush to move them. Get onto the floor so you are the same level as them and immediately assist them to get up. If there is no obvious injury or medical cause for the fall, carefully and slowly help them into a sitting position. Reassuringly check them completely to ensure that there is no unseen injury. Lastly, monitor them carefully for the next 24 hours or otherwise inform any of his or her family members. So let's proceed to the next injury or accidents that usually happen in a workplace, which is the cut or laceration. A laceration is a deep cut or tearing of your skin. Accidents with knives, tools, and machinery are frequently causes of laceration. In the case of deep lacerations, bleeding can be rapid and extensive. So what is the best treatment for a cut? So first, we need to wash our hands with soap and water. So next is we need to wash the cut to prevent infections. And next, we need to stop the bleeding. And apply a petroleum jelly. And lastly, cover the cut with a sterile bandage.